Joe, it's really good to see you. Tell us a bit about yourself.
So my name's Jo Holmes. I work for the ACP. I'm the Children, Young People and Families lead there, and I work for the policy team. So very much the driving force behind campaigning and speaking to governments in the different nations to progress really counselling and psychotherapy. And for my particular role, it's for 0 to 25-year-olds.
Brilliant. And I'm Mick Cooper, so I'm a professor of counselling psychology at the University of Roehampton and done a lot of research about school-based counselling and also counsellors in the community. So Joe, do you want to tell us a bit about what BACP have been doing around the kind of current time of COVID-19 and counselling for young people?
Very much so. Yeah, so what we've been looking at, we've had a campaign really, and we've got 10,000 signatories from various different organisations, members. It's like almost like a coalition of signatures really, to really get the government to think about the benefits of counsellors and psychotherapists working with people of all ages across all nations to provide that sort of critical support really to get them through the crisis and afterwards. So it's about really sort of trying to position ourselves to remind the government that investing in counselling is a really positive way forward and part of the bigger picture of all the different methods of support really that people can access.
So what do you think's happened with counselling for young people and children during COVID-19?
Yeah, so it's really interesting. So it's different across all 4 nations. So, in Wales, the school counselling service has continued. A lot of telephone counselling has been happening, and similar in Northern Ireland, and a different mixture of digital counselling, counselling via sort of tech support and various different ways of keeping in contact and video conference calls, etc. On different platforms, many different platforms really. And in Northern Ireland, it's been the same. In Scotland, they've recently, well, in the last over the last year, really committed £20 million to funding a school counselling service, across the whole of Scotland. And I think that was one of our main campaign asks really for England. Is 2 weeks ago we wrote to Gavin Williamson, the Secretary of State for Education, and gave some costings for what a school-based counselling service or services could look like in England. And we've had some discussions with the Department of Education as a result of that call. So it's very exciting times. So really, what we're trying to really capture now is producing that evidence base for school counselling. So sort of over to you, Mick, really, around, what is there to back our call? What does the evidence say about school counselling?
Yeah, well, we've done a lot of studies, both kind of quantitative, looking at what happens when people have counselling compared with not having counselling in terms of their outcomes, and then qualitative, talking to the kids. In terms of the studies, where what we've done is half the kids will get counselling and half the kids are put on a wait list for counselling. And we've done about 4 pilot studies, and we just got a big new study that we're having to publish soon. And generally what we see is that the school counselling definitely does bring about positive outcomes, that the kids seem to be doing, particularly in terms of things like self-esteem and achieving their personal goals. There's definite evidence that the school counselling helped. And there's some evidence that has emerged in some of the earlier studies that that kind of continues at least 3 months or so after the counselling. I mean, in terms of things like symptoms of depression, anxiety, the evidence is a bit more mixed. It seems like it really works by helping at least some of the kids who are coming to the counselling develop their confidence, feel more able to talk to people, deal with issues like bullying in their lives, talk more. A lot of what seems to happen is that it helps sometimes the kids talk more to their parents or other people in their lives that can help them address issues. And that's very much what comes out in the qualitative research as well, where we've asked kids basically, and there's a lot of studies like this now, asking kids, well, what was the counselling like, and how did it help you? And, not every kid is saying it was fantastic. It varies, and but probably about 50% or so at least are saying, that this was a really valuable experience. Talking, really value space to kind of talk and be listened to. Getting things off their chest seems to be really helpful for a lot of kids. And as I was saying, kind of getting things out there and then realizing that they can get things out there to other people as well. So the evidence base is pretty good. Teachers seem to really value the school counselling. And what they say is that they like that it's an independent, it's a confidential service. Parents, the research we've done to date seems to show that it's valued by parents as well, and they recognise that often their children need and would benefit from counselling. So the evidence base is pretty good. As I say, we're just about to publish these findings from our new ethos study, which we're hoping to come out. But we do also need to do more research, and I think one of the big things that we want to understand at the moment is what is the kind of lay of the land with COVID-19 around counselling in schools and educational settings. I think one of my big concerns at the moment, as you kind of talking about, is that in some places it may be that the counselling has been interrupted and that kids who are going to counselling maybe aren't getting the counselling that they were getting anymore, but we don't really know, and it feels really important to find out, and also really important to find out what can be done about it, and to find out from counsellors what they see as positive things that can try and ensure that there's as much support as possible for young people around their mental health.
Yeah, and that leads us really beautifully into a piece of work that we're working on at the moment, and it's we reckon there's about 10,000 counsellors and psychotherapists that work in across primary schools, secondary schools, in FE colleges across the whole of the UK. Many of which are BACP members, others will be members of different professional organisations, and I think trying to capture what's happened during COVID-19, how many practitioners have been able to continue under what guises, how have they delivered, and when they haven't, why not, is something we'd really like to capture. So working together, this is really what this particular sort of podcast is about. This video really at the moment is to reach out to counsellors and psychotherapists in the field, and to let you know that we're going to be doing a survey, a piece of research alongside Roehampton University to really capture what's going on currently and what counsellors need, and really to put more pressure really onto the government in England to really consider the benefits of funding a national programme for counsellors, and that's really where we're going with this particular piece of research. Anything really to add there, Mick?
No, I think it's just really important that we understand what's going on, and have the evidence. It's one thing to be able to say counsellors doing this and that, but having the evidence is so important to really be able to back that up. And also then to understand from people how we can improve the situation. So if you can respond, if you're a counsellor working with young people in an educational setting, we're really looking for people to respond and complete the survey, and links will be here in with the video so that you can do that.
Yeah, so this is just a big sort of appeal really to members out there, to counsellors and psychotherapists. We're going to have a piece of research that we'll be promoting hopefully during July. We'll promote it on different platforms, share it with friends, share it with colleagues. We need to get as many counsellors and psychotherapists to take part in this so that we can really together sort of begin to influence change. Thanks.
Thanks.